Have you ever considered the ethical implications of human testing? The scientific advancements, the medical breakthroughs, the moral dilemmas? With each stride forward in science comes a question of ethics. Human testing, a cornerstone of medical advancement, is often shrouded in controversy. The very idea stirs debates, provokes thought, and challenges our collective conscience. The exploration of its history is not just a journey through science, but also a reflection on our morality. Join us as we delve into the annals of history to explore the top 10 human testings. We begin our journey in the late 18th century with the first recorded instance of human testing. The year was 1796, when a man named Edward Jenner carried out an experiment that would forever alter the course of medicine. He introduced material from a cowpox pustule into the body of a young boy, thereby developing the world's first smallpox vaccine. Pioneering both the concept of vaccines and human testing, this groundbreaking experiment ignited a spark that would forever change the course of scientific exploration. Fast forward to the 1940s, when the concept of clinical trials began to take shape. The medical world was about to be revolutionized by a new method of testing: randomized clinical trials. It all began with the investigation of a novel drug, streptomycin, in 1946. For the first time, patients were randomly assigned to different treatments, ensuring the results were unbiased and reliable. This marked the beginning of a new era, where trials would become the gold standard for testing new treatments. In the same era, however, some experiments would cast a dark shadow over the field of human testing. The Tuskegee syphilis study, conducted from the early 30s till the early 70s, is one such grim tale. Without their consent, hundreds of African American men were left untreated for syphilis, under the false pretext of receiving free health care. This unethical experiment, widely regarded as a violation of human rights, still haunts the scientific community today. This study is a grim reminder of the ethical boundaries that can be crossed in the pursuit of scientific knowledge. As we move into the 1950s, human testing began to explore new frontiers, delving into the human mind itself. In the throes of the Cold War, the CIA embarked on Project MKUltra, a series of experiments involving the psychedelic drug LSD. These trials sought to unravel the complexities of the mind, pushing the limits of what was considered ethical research. Despite their infamy, these tests undeniably illuminated hidden facets of our psyche. These experiments, while controversial, undeniably pushed the boundaries of our understanding of the human mind. Following the controversies of the mid-20th century, the need for ethical oversight in human testing became clear. Enter the Belmont Report of 1978, a landmark document that forever changed the landscape of bioethics. It emphasized respect for persons' beneficence and justice, principles that have since become cornerstones of ethical research. This report sparked a global conversation about the rights and protection of subjects in clinical trials. This was a turning point, setting the stage for the ethical standards we uphold today. In the 21st century, human testing has become a highly regulated, carefully controlled process. The evolution of clinical trials has seen us shift from guesswork to the systematic evaluation of potential treatments. Emphasis now lies in the development and rigorous testing of new drugs, ensuring their safety and efficacy before they reach our pharmacies. These trials, though not without their controversies, have undoubtedly advanced our understanding of disease and the human body, propelling us into a future of improved health and well-being. At the turn of the century, one project would redefine our understanding of what it means to be human. The Human Genome Project, a global endeavor, painstakingly mapped each of the 3 billion base pairs in our DNA. This colossal undertaking unveiled the very blueprint of life itself, laying bare the genetic code that shapes our existence. Its profound impact on genetics and medicine cannot be overstated. This monumental project opened the door to a new era of personalized medicine and genetic therapy. Despite the advancements and regulations, controversies in human testing continue to arise. The creation of the so-called CRISPR babies has sparked heated debates, as the repercussions of gene editing are still largely unknown. Meanwhile, the deployment of artificial intelligence in medical diagnosis stirs concerns about privacy breaches and the reliability of machine learning. These controversies remind us that the ethical dilemmas of human testing are far from resolved. As we've seen, the history of human testing is marked by both astonishing breakthroughs and alarming ethical breaches. From the dawn of human testing to the rise of clinical trials, the line between innovation and ethics has often blurred. We've journeyed through notorious studies like Tuskegee, probed the boundaries of the mind, and witnessed the birth of bioethics. Today's controversies remind us of the importance of ethical oversight in human testing. As we continue to push the boundaries of science and medicine, the lessons from our past remain more relevant than ever.